Thanks everyone for joining us. For those who don't know me, I'm Jackie Gambrell, TSA's General Manager. And just to make sure you are in the right place, tonight we're going to be talking about transitioning from child to adult care. I'd like to start by acknowledging the traditional owners of the land and paying our respects to elders past, present and emerging. This always has been and always will be Aboriginal and Torres Strait Islander land. Now, I don't have my usual tech support tonight, so I'm hoping everybody is familiar with Zoom, and I'm pretty sure most of you will be. But just to go through a couple of the basics again, if you want to change your view, top right-hand corner, you can either have speaker view so that when Trish and Sharryn get started, you will mainly focus on them, or you can have gallery view so that you can see everyone on the call. And Trish and Sharryn will be using some PowerPoint, so that will be the main focus when they're doing their presentation anyway. In terms of audio, the mute is down there in the bottom left-hand corner. So if you want to put yourself on mute during the presentation, that's probably a good idea. Just click on the mute and that will put you onto mute. Also, the chat function in the bottom there, you'll see the little chat symbol. And if you click on that, you can send a message either to everybody or to somebody on the call. So maybe if you just chat, and if you've got the everyone in your chat, if you can just type a little message here, maybe saying what age is the child that you're with TSC that you're on the call for this evening. You've got a 17-year-old, an 11, getting in early, Valerie, like that. Anyone else able to just type into the chat, 18? Any other ages, 22, 15? So we've got quite a good range of age groups there. So thank you for that. And if at any point you're having any issues this evening, you can either type into that everyone or send a message to me. So that's to Jackie, and we can see if we can resolve those issues. Also, if you have a question as we go through, please feel free to put it into the chat. We won't necessarily come to it until we get to the end, but it will help you remember what your question was as well. And we might be able to take it as we go through. Now, having got that out of the way, and I hope everyone's feeling comfortable with Zoom, I'm pretty sure most people are these days, I would again like to welcome Sharryn Wells and Trish Thornton, who are both clinical nurse consultants with the child development team at Queensland's Children's Hospital in Brisbane. Sharryn and Trish, thank you so much for joining us this evening. And can we perhaps just get you to share your screen so that we can start to get the presentation underway?
Thanks, Jackie. I thought I'd just give a little bit of a background. So my background is I'm a paediatric nurse. I've been working at the Queensland Children's Hospital since it merged from the Mater Hospital. Prior to that, I was at the Mater Children's Hospital and then left for a little while my kids were sort of in those teenage years, and did some adult disability, educating primarily women with intellectual disability to manage their own healthcare. So that was really rewarding. And then I've come back, work in child development, and have been here for about 4 years in this role now.
Hi, I'm Trish. I've been a paediatric nurse for well over 20 years, and prior to that I was a midwife. I've been working in child development a very long time, more than 15 years, but I also worked in other areas in the hospital, including babies ward and intensive care. So I've got a very varied paediatric background, but I have always, and I did a couple of jobs recently, just acting in a nurse navigator transition role last year for a year. And prior to that, I did the clinical nurse consultant general paediatrics role. So, but I always end up back in child development, which I really enjoy. And we've got a great job here, great team to work with. It's a multidisciplinary team. We've got a developmental paed who consults into the TS clinic that's run out of neurology. It's not actually run out of child development, and that's a team of a paediatrician, neurologist, dermatologist, and renal physician. So the kids can see all those specialties and young people on the one day, but our developmental paediatrician, Dr. Prasad, consults into there. So we certainly have knowledge, and a lot of the young people might come through child development for assessment for autism or other developmental disabilities. So we meet a few of them, the young people with tuberous sclerosis. So we've certainly worked with children. So, but our talk is more a generic talk on transition, but there's lots of things that can be applied specifically to tuberous sclerosis. So.
Sounds good.
Yeah.
All right, I'm just going to share our screen.
And please, if you have any questions as we go through, put them in the chat, and there will be time for questions at the end. And can everyone see the screen okay? Can we get a couple of thumbs up for those who are on video? Yeah, beautiful. Thank you.
Thank you. Okay. So I thought I'd just start right at the very beginning. And what is transition? It's described as a purposeful planned process that addresses the medical, psychosocial and educational vocational needs of adolescents and young adults with ongoing healthcare needs as they move from child-centred care to adult-orientated care systems. So I think that's probably the biggest difference between paediatric care and adult care, is that we are very child-centred and focus on the child and the family unit. And then it becomes very orientated just around the adult and what's going on for them. And they aren't as inclusive as what paediatric nursing is for the whole family unit. Transition is generally optimised when there is a specific healthcare provider who takes responsibility for supporting an adolescent or young person and their family through the transition process. So when we talk about that, it's really important that families look at identifying who that person is going to be, whether that is your primary paediatrician within the hospital, whether it's your neurologist, whether it's your GP, whether you're in a situation where you have access to a nurse navigator or a specialist CNC nurse who can help you with that transition process. And then who is going to be the key once you transition to adults, and that's usually going to be your GP will take on that role. So we talk about how important it is to have a GP at the very early on in a child's healthcare journey, so that that family GP gets to know the child rather than waiting until your young person is 17 or 18 and transitioning out of a paediatric hospital. We talk about why is it important. It's important because we know that transitioning effectively from paediatric to adult healthcare can lead to better functional outcomes such as improved self-management. So improving the young person's overall well-being, better access to health services for the young person with complex medical needs, improved morbidity and mortality rates, and a reduction in avoidable hospital admissions. So looking at being planned and timely and not just going, okay, you're going to adults now and then waiting until something, the young person becomes unwell or something happens and then having to fit into an adult care system. You know, so, you know, an 18-year-old that has transitioned and breaks their leg, for instance, they will have to then go to the adult hospital, and then it becomes a bit more complex if they're not linked in with that adult hospital from their complex disability point of view. So, you know, if the adult hospital doesn't know about their TS, then that becomes tricky. So it's important that we do it early, and it's equally important for families and the clinicians to be on board and to start these conversations when the child enters high school. We start talking about, I see somebody was online and they have an 11-year-old, so that's really exciting that you're already starting to think about transition, because we want to start these conversations early. That doesn't mean we're transitioning you at the age of 12 or 13. It means that we're starting to have those conversations about where ongoing care will be and linking you in appropriately. So Communication and partnership with families and healthcare providers is the key to successful transition. Ensuring there's clear referral pathways is really important. As I said, start the discussions around 12 years of age, but no later than 14. And it makes clinicians' life really easy if the parents actually start talking about it with us, because we get a bit nervous about discussing transition with you as well. You know, like we know it's quite a big, it's really hard to transition. Families find it really stressful. So if we're starting that conversation a lot earlier, we're having those repeat conversations, and that really helps. Ensure the young person has a transition coordinator. So as I said before, your GP, a specialised nurse, a paediatrician, a neurologist, whoever is that key person in your young person's, that key healthcare provider in your young person's life that you can relate to and can help you with the transition. Good communication between the young person and the health professional, and between adult medical teams and the paediatric medical teams with the GP. Documentation of a transition summary and care plan, and Tricia's going to talk to that a little bit later about how we can how you can have control of that transition care summary and the care plan for the young person for adult healthcare, and involving the family to manage their own healthcare needs. So that sort of transitioning from and getting you as a family to be proactive and starting to take some control. So of when things need to happen, and questioning when testing might need to happen, or, you know, they should be due, I don't know, for x-rays, can we get that done, is really helpful. So I guess some common questions that is helpful for you as family members to be asking, or your young person to be asking themselves, is what are the knowledge in my healthcare skills? So what are the bits of my condition that I don't understand? What are the bits where I can learn more about? And where is, do I understand all the medication my child's on? Do I understand what all the specialists do? Do I understand how that will be different in adults? Is really important. What are my transitions?
Or if the young person's able, do they understand their medication? Do they understand, you know, what knowledge do they need? Because it will be more focused on the young person. Sorry.
What are my transition goals? So what do I want to achieve at the by the time I've transitioned? So for a lot of families, when I'm having conversations, and it's really good if your child, say, for instance, needs a general anaesthetic to have their teeth looked at, that's really important that we just try and get that done before they actually leave the paediatric environment, because it's a lot easier in paediatrics than it is in adults. If there's some significant surgery that they might need done, let's try and get it done in paediatrics, you know, before they leave, so that you know, you're comfortable in the hospital environment, you're comfortable with the healthcare clinicians that you know, you may be even comfortable with some of the ward nurses if your child's had several admissions to hospital. So thinking about those things, what can I do before I transition?
And sometimes they can be coordinated to be under the same anaesthetic as well, which is great, because sometimes you can get 2 or 3 procedures, particularly for, you know, children that are needle phobic. They might be able to have their immunisations at the same time as their teeth, and, you know, like dental in particular here are very obliging and will often, you know, just join in on another anaesthetic, and they can get a few things done at once, which is a great outcome for the family and the child and the young person, that they don't have to have more than one anaesthetic.
How do I improve my knowledge and healthcare skills? So what can I learn? And I guess, you know, you guys are tapping into these evenings, which I would happen quite regularly. So you're soaking up all that knowledge. So that's really important. And what support and resources do I need? And how do I find them? So again, tapping into talks like this and getting that information and those resources is really important. and then talking about a transition plan, which Tricia will talk to you about a little bit later. And then some common questions is, how does it work? A lot of families are really worried about losing that medical history, and they will often say, I need all the notes for the last 18 years from your hospital. But actually, we don't really need all those notes. We need a very comprehensive letter that every specialist writes for your child, because we really don't need to know that they were admitted at the age of 2 for seizures. Like, it's not so relevant now that they're 18, but what we need to know is that yes, the young child has, and the young person has seizures, and this is what they look like, and this is what their current medication is, and this is what their current rescue plan is. So there's no point having a whole, all the notes, but it's about asking your treating clinician for very detailed letter. Some of those letters can be up to 4 pages long, so really clear knowledge, so that you can take that to your next hospital. In Queensland, I'm not sure about the southern states, we're very lucky that a lot of our hospitals talk to each other. So we have a computerised electronic medical record that is a Queensland Health record. So if you present, say, to the Gold Coast Hospital or to the PA or to the Royal Brisbane, your notes are already there on the system. So that's really helpful. Do I have a say where I'm transferred to? I can't speak for the southern states, but we advise our families to ask the question. So it's really good if you can have your care coordinated in one hospital. Otherwise, you're seeing a renal physician, say, at one hospital and then a neurologist somewhere else. So we try and look, our main 2 hospitals are the PA and the Royal Brisbane Women's Hospital. And so we try and look at where the main clinician that is sort of going to take the lead for the young person is, and then try and do all the other referrals to that hospital as well, so that we, there's a little bit, just a little bit of cohesiveness, I guess, with the transfer process. When will I be transferred? That's always a really hard question to answer. I think I like to advise families that it's really good if we start the process early. If we get the referrals in early, then we will still see you until you're picked up by that new team. So certainly for our complex families, if you're 18 and you still haven't been seen by the adult team, we would still see you at that point. We're not going to say, right, you've turned 18, we cut you off and off you go. We try and keep you at least until we know you've got that next appointment. As part of our role, I will often tell families, even though you have transitioned from the medical team, as your clinical nurse consultant, I am available for phone, so they can ring and link in if they need to and ask questions about the transfer. And I sort of, most of the complex families, it's sort of about 6 months that you might get a phone call from those families until they're actually transitioned and linked in properly, because there's nothing worse than just going from something you know to something you don't know and not having that link. And we as clinicians can find out information for you and help you navigate you to who to contact. And I guess meeting the adult healthcare team before transfer, that's a tricky one. We have some of our very specialised teams don't find that particularly helpful, because it's really hard if you go and meet a neurologist for the first time, you don't have that rapport with that person as you would with your current neurologist. So sometimes it's not helpful, because then you want to default back to what you know. We always are much more comfortable with what we know. So we don't tend to advocate for that a lot.
But there are some specialties that run transition clinics where the adult healthcare team will come over to the children's hospital, but it's not very common. Yeah. And it's usually from the MATA, because they're right next door. So they might come over and meet the young person before they move next door.
Yeah. And how do I know I'm ready to be transferred is when Well, two things, age, but also when you feel comfortable. So it's again about having those early conversations and ensuring that things are in place. And as it says, the main objective is to ensure that there's no disruption to your medical care. So that's why we will often see, so we'll do a referral early, give you another appointment. You may or may not, if you've been seen in adult space, then you don't need to come back and see us in paediatrics. But if you haven't, then you can come and see us in paediatrics so that we know that, you know, your next appointment is going to be in 3 to 6 months in the adult world. So what can transition look like for you? Again, I suppose a little bit repetitive, but start having discussions early with your child's paediatrician or neurologist or renal physician or dermatologist or ophthalmologist, whoever it might be. And I like to say, we like to say around 12 years of age, and also good for if the young person is capable, is for them to be part of those conversations and start saying, when I go to adults, who's going to look after me and what is that going to look like? Ensure your child is engaged with the GP, because the GP will be critical for the long-term care of the young person. It's very, very difficult when we have a conversation at the age of, with your young person being 17 and say, do you have a GP? And the answer is no. And then you need to find somebody that you're comfortable with and that the young person's comfortable with asking those questions. So if you can get linked in with your GP a lot earlier, it makes it a lot easier for ongoing care. Ensure you're engaged appropriately with community services. So it's not just about healthcare, it's actually ensuring that we're linking into, that we're thinking about post-school options, that you're thinking about what sort of work that the young person may do post-school, making sure that your NDIS is all up, is looking at your post-school options and how there might be support for your young person to enter the workforce if that's what they wish to do. It's not just about healthcare. Start to be organised, start to keep your discharge letters in a folder, and Trish will talk to you about some really clever apps and ways to keep that information. Register the young person for My Health Record, because that allows information to be uploaded onto that and for clinicians to be able to see that. Transfer process may take some time and might occur at different points if you see multiple medical teams. So this is where it does get a little bit tricky for children that see multiple teams. You might have been picked up by the renal physician and be seeing an adult nephrologist before you see an adult neurologist. So there potentially is a period where you do have healthcare across two settings, paediatrics and adults. Begin to develop a transition plan and discuss with your child's medical team what ongoing monitoring and tests may be required in adulthood. So, you know, you might have been used to having, because children grow and change, we do tests a lot more frequently in paediatrics than we do in adults. So a test that we might have done every 6 months in paediatrics while they're growing may not necessarily need to occur in adults. So it's really important that you have a clear understanding of what is required when they become getting to adult healthcare, so that you can either tell the clinician that they're due, or you're not worried if they're not having them as frequently. Prepare the young person to have their own Medicare card, healthcare card and private health insurance if appropriate. Definitely their own Medicare card and healthcare card from the age of 16. And even talk to the adult healthcare team about where your appointment is and parking and access and cost and everything of attending a new hospital and what that might look like. Ensure your young person has a bank account in their own name. It becomes very difficult after the age of 16 to do this. So if you could do that prior to 16, it's helpful. and contact Centrelink to inquire about financial assistance for the young person. So whether they're entitled to a disability pension or not. And also contact QCAT to organise guardianship and appointment of administrator for their finances if your young person has impaired decision-making skills, and that usually needs to happen by the age of 18. And it's very self-explanatory on their web. And preparing for your move and allowing time for transition will give you time to think about the young person's healthcare needs into the future. It'll give you time to talk to their healthcare team. It will strengthen your links with the GP and the community. It will help to choose what healthcare best meets your young person's healthcare needs, and it will reduce your stress and anxiety at leaving the children's hospital. So that's, I don't know whether we want to stop for questions before Trish talks about resources, or whether you would be happy for us to keep going. Trish is going to talk about a lot of resources that we are available to you.
Well, I might keep going and we can have questions at the end.
Yeah.
So there's a lot of these resources are on the Queensland Health Children's Hospital website. So you'll be able to see them if you just go into the Queensland Children's Hospital on Queensland Health website, and there's a tab for, you can just type in transition, and all of these, well, the first couple of resources are available on the website, so you can have a look at them then. In your state, there would be very similar resources. I'm going to talk about the resources we've got available at Queensland Children's Hospital, but I know that in New South Wales there's an organisation called Trapeze, which have excellent resources and also links for local, community resources and things like that. And for Victoria, the
Royal Children's Hospital in Melbourne.
In Melbourne have some great resources regarding transitioning, and some of the there's lots of similar information on those websites as well. So as Sharryn said, it's a really good idea to be organised, and these resources can help you be organised and have a summary and things. So first up, this is just
I think you've gone on to mute, ladies. Trish, I think you're on mute at the moment.
Send them a message in the chat bar.
Okay, that's all right. I should have kept driving, I think.
Yeah.
I gave it to Trish.
Thank you.
It's too much to think about.
That's all right. Let's go.
I've just got a quick question. You mentioned Trapeze. Was that in Brisbane, did you say?
No, that's in New South Wales.
Sorry about that.
They're an organisation, and they have a number of transition coordinators working with the organisation, as well as have lots of great resources on the internet. And the Royal Children's Hospital, if you just put in the search transition, you'll see lots of other, lots of information on the Royal Children's Hospital in Melbourne. So that's Victoria. And I'm sure...
they're interchangeable. The resources from New South Wales and Melbourne, there's lots of information, and I suggest you tap into them, and Queensland, even if you don't live in that state, because there's lots of general information that will guide you.
So next one. So this is sort of a flow process. This is mainly, this is sort of a tool for clinicians, but it's also handy for parents to know what the process is. Basically going through all the things that Sharryn talked about, identifying when your young person's ready for transition, as Sharryn said, about 12 to 14, or as they enter high school. And then again, the coordinators identified. So when I was a transition nurse navigator, a number of doctors contacted me and said, oh, could you help transition this young person? They're going to be 18 in a month's time, and they had really complex sort of, multi-specialty condition, and, it was all terrible, and the parents were often not prepared, and, it's sort of, it's a lot better if things are more organised and started early. And as you know, a lot of hospitals have wait lists, so it would be quite disjointed if things weren't, done a couple of years earlier than that. So it's a matter of liaising with all the specialties, make sure that, they'll start writing referrals around 15 to 16. Looking at, a good tertiary hospital with young people with TS, they would need all the specialties that you would be aware of, preferably under the same roof. And often it's worth asking in Queensland, I'm not sure what the situation is in the other states, but whether there's a nurse navigator that can help coordinate your young person's care at that hospital, because often they're a good point of call. Sort of a fairly new service in Queensland, but they're, or even a complex care or connected care or something like that, so that appointments can be coordinated, and they can be looking out for referrals and things like that. As I said, a coordinated approach is ideal, and it's great if all the specialties can talk to one another and coordinate together, so they're not operating in silos. We talked about any, before you leave the children's, any last minute procedures that the child might need. Ideally, if you transition should occur at the same time, but sometimes there's a bit of a crossover period where the young person might be visiting the children's and the adult hospital. So next, please. This is one of the resources available on the Children's Health Queensland website. And again, some of these resources may be suitable for your young person, particularly if they're more cognitively able, and they can, because teenagers inherently want to be independent, and they might start wanting to go into appointments on their own and taking a bit more ownership of their care. And so this is a checklist that if your young person's able to complete, that's great, but also that the knowledge that's in the questionnaire, the checklist, is something that you as a parent may need to make sure that you know all about, anything that you're not aware of, or medication, or, referrals, payment for appointment and things like that. But yeah, your young person may want to start going to appointments on their own, and will want a bit more privacy as young. Oh, sorry. That's right. We've got the cleaner coming to clean. They'll probably ask us to leave soon. Yeah. So that's quite a good checklist that covers all that, and making sure that you've got appointments booked at the new hospital. Anyway, as I said, they're on the Queensland Health website, so you can have a look at them. So that's the checklist. Now the information from that can build into the next document, which is integrated transition summary. It looks like a document that doesn't have a lot of room for all your young person's different conditions and procedures, but as you can see, it can be enlarged as like when we're completing online. So that document can end up being quite large, like more than 2 pages. It can end up being, 4. I've done a couple that have been 4 or 5 pages, like by the time you put in all the medications and procedures and different specialities. There is a questionnaire called the HEADS, which is a psychosocial interview for adolescents for children, young people that are more cognitively able, and that can sort of, if that could be completed prior to this document, you'll have lots of valuable psychosocial information about education and employment, and their eating and exercise, what activities they do, and unfortunately the drugs and alcohol may raise its head, and things like that. So it's just something that, if possible, it's every now and then you might have, it'd be great to have that completed, because you will get some good information out of that assessment. So as I said, the form kit, we've also got a new guide that for adolescents and young adults that's just been uploaded onto the Queensland Health website. Again, this is for your more independent, cognitively able, but there's lots of great links and information in there. And, you know, it can be helpful for parents as well. But some of it's probably may not, you know, we don't give it to all the parents. So
I think it's a document that has lots of information, but it just depends on where your young person is at and how much responsibility they will be able to take for their own healthcare and moving into adulthood. But it does have lots of information in it.
There's an app called Sortly. Sortly's it's a free mobile app that's been designed in consultation with young people. It's easy to navigate and it just provides a step. It's quite a useful app. It's a step-by-step guide for all the important information in the young person's life, such as identity, relationships, education, employment, money, and legal, knowing your rights and living skills. So there's a lot of information and housing and looking after your health. So that's something that your young person might like to look at that has a lot of people have found quite handy. For young people that have are complex and need more advocacy by their carers or their parents, there's the Ask Health Diary. This diary was designed to improve the poor health status of young adults with intellectual disability. So the young person might be accompanied to the consultations with health professionals. So they developed a diary that everyone could contribute to. And so that people with an intellectual disability feel that they have some sort of control over their life and that they've got, they're able to make decisions about their health interventions. It's got different sections to it. There's an All About Me section that records personal details, communication, where they're living, activities, and lots of contacts for their family and also for health professionals. So it's sort of just trying to get all the information into one spot. And the health advocacy provides information on how to prepare for the young person's doctor's visits. Yeah, so this is more helpful for the young person that probably needs a bit more of a hand and to keep things in the same place, as is the next one, which is, I was just going to mention QSID has got a great website. It's run out of the University of Queensland, and they're great advocates for intellectual and developmental disability. We have a lot of young people from our service, the Child Development Service, that the clinic used to be called QSID, but now it's called MIDAS. So that's located at the Mater Hospital, and that's a clinic for children with intellectual and developmental disability. But there's lots of resources on that site, and that's one of them you can have a look at for any young person with an intellectual disability. Julian's Key, the health passport, is also for children with complex disability. So that's a communication tool. Again, it's basically trying to get all the information in one place for people with disability and chronic health conditions, so that if they are admitted to hospital or if they move, that somebody's got all the information and the young person's able to communicate their specifics, what specific support and healthcare they need. It's available on a mobile application, or you can get a PDF or paper-based format. It might have things like the NDIS information, any positive behaviour support plans, any disability care summaries, and advanced care directives and statement of choices, and also information about their enduring power of attorney. So I guess you choose what resource might be suitable for your young person. So the last slides, we talked about the New South Wales, the Agency for Clinical Innovation, that's Trapeze. And then there's the Mater Young Adults. We've got so the Mater has a big area for called MIAC, and so they've got an inpatient ward next door for 16 to 25-year-olds. And they also cover a number of specialties that may, and they have adolescent clinics, young adult clinics for mental health, but also they've got clinics for cystic fibrosis, diabetes, gastroenterology, gynecology, respiratory, and as I mentioned, the Mater Intellectual Disability and Autism Service, that's MIDAS. And as I said, they've got an inpatient ward as well. So that's a nice sort of stepping stone into adult care. And I wish there was more hospitals that had something similar to that, but unfortunately there isn't, not in Brisbane. But yeah, so they've got a small area for adolescents. And as I said, the Royal Children's Hospital Melbourne have got lots of information. And that's...
Excuse me, can I just say that Midas clinic is only a referral service. You can only go there 3 or 4 times and then they refer you on to who needs to see the person?
Yes. But you can go back. Like, I think they problem solve, and, you know, if the young person's got unfortunately, there's not, like, I think once you're in the children's hospital, you're in the children's hospital off until you're 18, and paediatricians in particular, or, you know, if it's things are going along quite well, they'll say, see you in a year's time, but things aren't going well, they'll see you in 3 months' time. But unfortunately, in adult services, a lot of areas like that will not just indefinitely care for your child, unless there's, you know, there's acute things that need to be monitored, but a lot of places may discharge until you require.
And then you refer back in.
Yeah. But you can certainly go there more than once.
And the other thing in our experience, Olivia's 22, and we have tried to get all of her physicians in one hospital unsuccessfully.
Yes, unfortunately. So the referrals in Queensland Health will go to the referral centre, and they'll, you know, like, you might go to one hospital for neurology, and that's unfortunate. But
and actually, we are at peace with that.
I think you're right, Olivia. I think it's about, so our goal is that we try and get all your care in one hospital if possible. We don't have control over the decisions.
It's impossible because the PA have the tuberous sclerosis clinic. They don't, and they will never probably have, and they haven't definitely for the last 4 years, had a neurologist. So you can't go. Yes.
Sorry, I shouldn't laugh. It's very unprofessional.
And then if you go to the Royal Brisbane for ophthalmology, they send you the PA, and then the PA send you back. So we have done that. And I suppose we found it hard to keep and maintain cardiology as well. So we've gone right back to the start, and that was to the diagnostic doctor, which was Dr. Chris White, and he's a paediatric cardiologist that happened to just rub his hands of the public system, went out on his own and bulk bills over at, you know, some little hospital. So we're back right where it started.
Yeah.
But you said, Olivia, I picked up that you said you were at peace with that. So is that?
I'm Olivia's mother, and yes, we're at peace with that. It's impossible. It's an impossible ask to get all physicians in one hospital. You know, we've got 5 hospitals involved, and that's about the best it can be.
That's disappointing.
And I think a lot of parents hear that before they leave the children's hospital, and that's why there is often a big reluctance to leave the children's hospital, where, you know, it's a one-stop shop often, and, you know, a lot of hand-holding and making sure, but adult service can be quite different. But I think preparation is definitely the key, and I guess it's got to happen eventually, so it's tough.
And the interesting thing for us as clinicians with lots of paediatric experience, it's probably only been in Queensland, probably the last 3 to 4 years, that we've got a big push for transition and are trying to do it better. So I can see that change is starting to happen. It's just going to take a while for us to get there. And a lot of our barriers are adult clinicians coming on board and wanting these kids transitioned. They don't see that they, 16 to 25-year-olds, regardless of whether they have a chronic health condition or not, are not ready for adult world. So, to expect that a child with a chronic condition can just go straight into an adult hospital and everything be okay is a little bit unrealistic. And I think we're starting to have those conversations, and there's lots and lots of work happening within Queensland Health around that, to the point that we've actually got linkages with some of the hospitals. We've got linkages with, particularly with Prince Charles, are doing a lot of work around transitioning children, and it's an ongoing care referral rather than a new referral. So I think we're going to see some progress in the next 10 years or so.
Well, we were a little bit part of that progress, I suppose, but we're done with it. We're happy. Olivia's happy. She sees different doctors in different hospitals, and it's fine.
Yeah. And I think that's good to know, because I think, we like to get carers. It's good for other families to know that it does work, even though if you do have to see different clinicians in different hospitals, that's okay. And I suppose it's no different to, like lots of people have to go to different hospitals for different, you might have neurosurgery at one hospital and you might have gynae at another hospital. And we're okay with that as adults. So I think it's about expectation. I think a lot of transition is about expectation. And I don't think we prepare families well enough for the expectation that adult health care is very, very different to, not the quality of the care, but just the whole experience is very, very different to paediatric care.
I think it's deeper than that. If we had exactly the same hospitals in all the areas, then that would be, well over budget. So I think that's why they do that. So like, if you're having a heart attack and you want to go to Prince Charles, I'll take you there because that's a cardiac known hospital.
Yeah.
So, we can talk about Queensland Health, but, you wouldn't go to a dietitian at the Royal Brisbane. You'd go to the QE2 any day of the week because they have the best specialised people in that hospital for that little area.
Absolutely, and I think that's what we do, and it's very tricky when you come from, particularly on the East Coast, where we have very big children's hospitals, where it is, as Trish said earlier, it's a one-stop shop. We don't have 5 children's hospitals in Queensland. We've got 1, but we do have some very, very good public hospitals in Queensland, or just even in Brisbane, that provide specialist services.
But one of the reasons Queensland Children's started was because the Royal Children's offered oncology and the Mater Children's offered cardiology. And so if you had you needed cancer treatment and had a heart condition, you had to go to
between 2 different hospitals.
Yes, hospitals were connected by a tunnel, but we got rid of that.
Can I ask a question?
Absolutely.
I think another concern I have, it's good once you get your neurologist and all the doctors in a row. I think my other concern maybe is like if we have to take her to adult emergency, or not that we've had to do that a lot now, but going into an emergency situation or something like that where they don't know her at all and having a complex disability and disease. So yeah, it's a bit uncertain.
Yeah. And that's where having some of those health documents that we talked about is really good, because if you've got that, either an app on your phone or a piece of paper that just gives a brief, idea. So for me as a nurse, if I've got a child or when I did adult disability, actually the biggest thing for me is I want to know how to communicate with your young person. If I know that your young person communicates or is nonverbal or is scared by touch or needs me to, just what she needs. If I know that she needs to have a teddy with her, then that's okay. Like they're the important things as nurses that I think we need to know when you present to the adult hospital. So if you've got a document that says that and what's normal for her, because you're stressed. If you've brought her to emergency, you don't want to be telling what is her norm. Then you get frustrated because of the way we communicate with her.
Actually, I can help with that. With Olivia skates, she roller skates. And a lot of the time the doctors in emergency will say, oh, she's back to base. And we go, oh, actually, she's not. And we show them the footage on the on our phone. And then she's straight to rehab for 3 months. It's a classic, right? Because they think tuberosclerosis, she's back to norm, she's back to base. And we go, oh, no, she's not. You look at this. And then they look at this, on our phone, they look at Olivia and say, right, straight to rehab.
And I think that's a really good, be really advocating to, what is her norm.
So it's a vision prompt too, like they can see it. And they look at us in disbelief and they say, oh, is that Olivia? And we go, yeah, actually that is Olivia. And that was only taken a week ago. And they're right. Straight to physio, straight to rehab, straight away, back to base. We're not letting her out of this hospital till she's back to base. And we say, great. So I think, having that visual, because in emergency, they only see them, quite poorly. So it's good for them to see what is, their base, Olivia's base in this case.
Did that answer your question, Debbie?
Yes, I've just thought about that, having an app or something with everything on it now, because I think that'd be really helpful, even going in with meeting the new neurologist and everything like that. And just one other thing I just want to say, we're actually going to have a joint meeting with the pediatric neurologist and the adult neurologist, which they suggested, which I thought would be really, really helpful, because but that works because they're next door to each other. So that's why I can understand that won't work for everybody. But for me, when they told me that, I was really relieved, because then it's not just a letter. It's them explaining, or having the adult neurologist who's not a TSC expert, which is fine, asking the pediatric neurologist any questions they have when we're there. So I really like that idea.
Yeah, you feel like a proper handover's occurred. Yeah.
And the other thing, I do a lot of transitioning of girls with another complex syndrome, and we will often, when they go to their new adult physician, is actually say, well, you can actually tap into us and our experts here, and they often do that for the first few weeks, and there's nothing, or for a few months, and there's nothing wrong with that. And I think as a parent you can advocate for that. Look, you've admitted you're not a TSC expert, so I'm sure that you could send an email to and ask the question, and I would be advocating that as a parent.
Thanks.
Thank you everyone for participating tonight. Thank you, Sharryn and Trish. We really appreciate you coming along and giving us the benefit of your knowledge, your expertise, and also your time. Are there any final questions or comments that anyone wants to make? If so, please raise your hand. Otherwise, we will say good night and thank you so much.
Thank you.
Thank you.